We're at the IS meeting in Amsterdam. We're here with Sarah Brown from UCSD, and we really appreciate the taking the time because this was a press conference on, was it Monday?
The 24th, Tuesday.
Yeah, Tuesday. It runs together. But the important thing was that you had a really novel way of tracking PrEP. It's really an amazing program. So I really want you to explain it as carefully as you can for people who are somewhat well-informed, others less well-informed.
Right. Yeah. So as you know, pre-exposure prophylaxis now is available in the form of Truvada, which combines tenofovir and emtricitabine. And to be effectively protected from getting HIV infection, we really know that you need to take it daily. And medication adherence looks at how well people are actually able to do that, to provide themselves with protection. Mm-hmm. And physicians, particularly in the United States, really emphasize daily PrEP. So what we have been working with is a brand new technology that uses an edible sensor to monitor whether you've actually ingested a medication. So we've never had a technology like this before. Most of clinical practice still works off self-report, and I think by our age all of us have taken medication and it becomes more difficult to remember. There are days you get busy and you lose track of things, and honestly I've had days when I can't remember whether I've taken a medicine or not.
Because it all seems the same. If you do it at the same time of day, say, was it today I took that or was it yesterday?
Yeah, did I do it? You know, I mean, even vitamin pills. Did I take a vitamin this morning? You know, it's hard to remember. So what is generally happening in clinical practice, you go in and you see your provider and they're going to ask you, and you're supposed to recall what happened over the last month, or usually, and for most of us, the last 3 months, and we sort of do an estimate. So this is a brand new technology that actually has an ingestion sensor. The ingestion sensor is made of minerals. It's got copper, magnesium, it's got a very thin gold layer in it. So these are really minerals that are in most vitamin pills. It's an edible sensor, and it's all FDA approved. And they work in a system. So the patient has to wear a patch, and I can show you an example of one of those. And then when the ingestion sensor is swallowed, it starts to dissolve. But because it's composed of minerals, as it dissolves, there's an electrolyte change. So there's a little sort of pulse signal that's issued. And that little local pulse signal that is completely dictated by the electrolyte change in the stomach is picked up by your patch and stored. So you basically have stored information about every medication you've taken that has this ingestion sensor combined with it. And then it has a tiny Bluetooth in the patch, and that Bluetooth can connect to your paired mobile device. So if you have if you have a Samsung or an Apple, you basically pair your phone with the system. And then when you put your phone in your pocket, or you pick up your bag, or you walk into the room where your phone is, as long as it's within Bluetooth proximity, all the data about what medication you've taken is uploaded onto your phone.
Wow.
So that's great because you can actually look at how you've been doing. So it's empowering for people. You can see how you've been doing, you can keep track of yourself. But in addition, what they've done is, because it's the information is available on a cell phone, it can then be uploaded through Wi-Fi or cellular networks to remote servers. And all this information and data relay is done encrypted, just like the same protocols we use for banking. So your information, you're not a number, your information is completely protected.
Right.
Because that's really important. And they use very strict protocols like they use in banking.
I see.
So then the information is stored on a server, and if the patient who uses the system wants to, they can give their provider or healthcare worker that they want to work with access to this, or a significant other access to this. And they can go online and so you can just quickly go online to your website and see whether your patient or your partner's taken the medication and is therefore protected. So it's interesting because one of the reasons we started working with this company is that they built this as a patient self-management device. And their whole philosophy was patient empowerment. And I think that is that really made a huge difference to us. The other thing that made a huge difference to us starting to work with these people is that the patient owns the data. And that's critical. So the patient decides, this is their data, the patient decides, do I want to share it with this provider or that provider? Do I have somebody that I want to help me support my medication taking practice or not? So the patient's in the driver's seat and they're learning to manage themselves, learning about themselves, educating themselves. So that's one of the reasons we started working with them. And what we've done is adapt the system for PrEP. And we found a method to combine the sensor with Truvada. At the moment, we put it in a gelatin capsule with a little sensor in it. And then we had to test that to make sure that it was equivalent to native Truvada.
Right, I was going to ask you to...
Right, so that's really the bulk of the data that's gone into the poster presentation, which was a late breaker at this meeting, was, we tested it pharmacokinetically to make sure that the maximum concentrations in the areas under the curve were really the same and equivalent to native Truvada, and they were. The other thing we have shown at this meeting, we have an ongoing study with more than 65 people in it at the moment using this system to track their own PrEP taking. And we've shown some of the patterns that the subjects have, and this system is very adept at picking out people very quickly who really have very regular medication taking habits and don't need a lot of support, from people who maybe start out looking good in a week and then sort of change, and then over a month or 2 months are looking much more chaotic, missing a few doses. So what that does for the healthcare system in general is that it helps pick out people very quickly who need more support.
Right.
And as we're trying to roll out PrEP, and we really need to get PrEP to as many people as we can, then the issue is going to be how can we help healthcare systems pick out people quickly who may need more support than others. So that's a real plus for the system.
Right.
And then finally, we just sort of have the early tidbits of how did people like using it, and so far the reaction's been very positive. So the actual results of the full trial won't be out until next year, but we've entered our preliminary data, and we were delighted that people were interested in this, because our aim is to get this up and running, introduce the medical clinics to this, and then really give it to the patients, because they're going to be empowered and they're the people that need it.
Right. Well, this is important, and I'm really appreciative that you took the time to visit with us on this, and to get out the message that this is going to be out there soon.
Yes, it's out there soon. So it's all FDA approved. It's all CE marked in Europe. And I think that we're going to have some very interesting data on how people wanted to use it, how people felt about it. But we're very excited because we think that this could be a real breakthrough to empower patients and then really help healthcare systems get some information about how to focus their resources. Right, exactly. Because some people really need much more support than others.
Right.
And this is going to help.
Yeah. Well, thank you so much. I really appreciate it.
Thank you, Fred. Thank you for your time.